Hi, my name is Tim and today I'll be showing you how to administer a medication through an IV piggyback. So I've already compared my MAR with my doctor's orders, making sure that I have the right patient, being aware of any allergies, making sure I have the right drug, the right dose, the right route, and the right time, and I put my physician's orders away. So I'm going to select the correct drug for my Pyxis, and now I'll do my first check. So the right patient is Mike Brown. I have a vial here for Mike Brown. The right drug is Cloxacillin, and my vial is for Cloxacillin. The right dose is 1500 milligrams. I have a 2000 milligram vial, so I will have enough of the drug. The right route is through IV. The vial says for injection. I will make sure with my monograph that it can be given through IV. And the order time is every 6 hours. It's now time for the next dose. Right, so now I'm going to be looking at my monograph for instructions on reconstitution and dilution. First, I want to make sure that I, as a student nurse, can give the medication, and it says here that it may be administered by a nurse or student nurse, so it's safe. The usual dosage is 1 to 2 grams through IV every 46 hours. The max single dose is 3 grams. My order dose is 1500 milligrams, so it is both within the usual dose range and below the max single dose, so it is indeed a safe dose to give. For reconstitution, I'll be needing sterile water, so I'll select my sterile water vial here. The medication is provided in 2 gram vials, and I'll have to add 6.8 milliliters of sterile water for injection. So I'll make sure that both my medication is not expired and that the vial is intact, and that my sterile water is not expired and that it is intact. So gather my supplies here. Right, so for reconstitution, add 6.8 mils of sterile water for injection. So as I attach my syringe to my needle, I want to make sure I keep both ends sterile by not touching them. And I'll want to wipe the top of each vial with an alcohol swab for 30 seconds and let each of them dry for 15 seconds, again to avoid contamination. So wipe each for 30 seconds and let each of them dry for 15 seconds.
I was like right at the end.
Tapping out any air bubbles. Just recapping with the scoop method to avoid any contamination and needle poke injuries. Right, so to reconstitute the med, I'm going to roll the vial gently in my hands just to prevent any air bubbles from forming, being sure not to touch the top of the vial so that it remains sterile. I'm going to roll the vial until the solution is clear and the powder is dissolved. So there. So my order dose is 1500 milligrams. I did the calculations, and that means I have to withdraw 6 milliliters of medication. So I'll do that now. Knocking out air bubbles, pushing it to the correct dose of 6 milliliters. And again, just recapping with the scoop method to avoid needle poke and contamination. So before I dilute, I'm going to be doing my second med check. So I have the right patient, Michael Brown. I have a vial here for Michael Brown. The right drug is Cloxacillin, and I have a Cloxacillin vial. The order dose is 1500 milligrams. I did the calculations at 6 milliliters, and I have 6 milliliters drawn up in my syringe. The right route is through IV. And looking at the monograph, it says that it can be given through IV, so that's the right route. And the right time is every 6 hours. It's now time for his next dose. So for dilution instructions, it says that for a 2-gram dose, to dilute it in at least 100 mils of D5W or normal saline. Because my dose is 1500 milligrams, so it's below that level, I feel safe, I feel comfortable using those guidelines. My patient is fluid restricted, so I am choosing to use a 100 mil normal saline mini bag as opposed to a 250 mil mini bag. And I'm choosing normal saline because my patient's primary line is also normal saline, so I just want to ensure compatibility. So I'll grab my mini bag. Again, checking for expiry dates, making sure it's intact. I'm going to use an alcohol swab to rub the injection port for 30 seconds. And I'll let it dry for 15, making sure it stays sterile before I inject my medication. So my syringe can now go in the sharps container because I'm done with it. And now just to mix the medication, I'm just going to roll the mini bag gently in my hands a few times. And I'm now ready to make a med label for my medication. On my med label, the information I'll want is my patient's name, so Mike Brown, the rate of the drug, Cloxacillin, the dose is 1500 milligrams, the volume is 106 milliliters, that's 100 mils of normal saline plus 6 mils of Cloxacillin, so a total of 106 mils, the date, the time, and my signature. So I can attach this to my mini bag now. So the maximum rate that I can administer the medication is over 30 minutes. Because it's the first time my patient will be receiving the medication, I'll be administering it over 60 minutes just to ensure I don't irritate his IV site or the veins in his arm. I'll grab the rest of my supplies. I'll need my tubing kit, some alcohol swabs. And as I enter the patient's bedroom, I'm doing a quick safety check, making sure there are no hazards in the way, making sure my patient's not in distress. And I'll approach my patient. Good morning, Mr. Brown. My name is Tim. I'll be your student nurse for the day. I'm here to give you some medication, but first I need to confirm your identity. Could you tell me your first and last name, please? And what is your birthday? Do you have any allergies, Mr. Brown? No allergies? Alright, that's good. How is your IV site here? Have you noticed any swelling, any pain, tenderness? No? Alright, that's good. So I'm just checking his IV line here, making sure there are no occlusions, no kinks, making sure the clamps are off, and just making sure that the primary line is running okay. Alright, Mr. Brown, I'm just going to do my third check, so give me 1 minute, please. So for my third check, I'm going to be comparing my mini bag with my label to my mark. So the right patient is Michael Brown. I confirmed his identity as Michael Brown. The right drug is Cloxacillin. I have Cloxacillin here. The right dose, 1500 milligrams. 1500 milligrams. The right route is through IV. I confirmed that I can give it through IV. And the right time is every 6 hours, and it's now time for his next dose. Alright, Mr. Brown, so I'm here to give you your Cloxacillin. It's an antibiotic to treat your pneumonia, your respiratory infection. Some side effects you may experience include abdominal pain or nausea and vomiting. If at any time you experience these symptoms, please pull your call bell and I'll be right with you to help you out. I'll be back later on to check on your lung sounds, see if you still have crackles, if you're still coughing, if you feel short of breath. It will take a few doses for you to, for your symptoms to resolve, so just keep that in mind, but we'll be checking up on you regularly. You do have the right to refuse if you want, but are you okay with taking this medication right now? You are? Alright, so I'll get it set up. So when spiking the mini bag, it's important that you don't touch the spike once you remove the cap, and that you, once you remove the cap from the mini bag, that you don't touch that either. So just spike it like so. And that's just to avoid any contamination. And before I connect the secondary tubing to my primary tubing, I want to clean the port for 30 seconds just to avoid contamination. I'm choosing to use a port that is above the pump. This ensures that the medication is infused, is regulated by the pump and not by gravity. So I'll rub that with an alcohol swab for 30 seconds, and I'll let it dry for 15 seconds. Making sure not to touch either end. Right. And right now I have air in my tubing. I don't want to instill air into my patient, so I'll back prime the medication just by lowering it. Just want to make sure my drip chamber is about 1/3 to 1/2 of the way full. And so as I mentioned earlier, I'm going to be administering this over 60 minutes. So I'll set up my secondary line here. Secondary, volume rate is 106. My rate is 106 mLs per hour. Secondary, start the secondary line. I want to make sure my clamps are off. And before I leave my patient, I'm going to watch for 3 drips in the drip chamber. So there's 1, there's 2, and there's my 3rd drip. Alright, Mr. Brown, so like I said, I'll be back in a few minutes to check up on you, make sure everything's infusing properly. If you experience any pain or any of the side effects I mentioned earlier, please pull your call bell and let us know right away. And before I leave my patient's bedside, I'm going to be attaching tape to my secondary tubing, just so the next nurse knows when to replace the tubing. So I'm going to include the date, the time, and my initials. And before I leave, I'm just going to document on my MAR that I have given Mr. Brown his medication. So that's how you administer an IV piggyback medication.